How's it going, everybody? My name is Jesse. Welcome back to Male Nurse Mentor. We're going to be talking about the best way to leave bedside for the people that want to know. This is a pretty odd topic because I know when people think of nursing, they think of bedside, but the reality is maybe it's not for everybody, it's not the best fit, but it's also maybe not the interest for everybody as well. And that's okay. I'm going to tell you guys that that is okay. You can still build your career out without having a desire to work bedside. And I can tell you that because that's how I did it. I worked the floor, but I didn't work bedside in a hospital. And now I work as a nurse consultant. And to be honest, now that I've left the floor, never worked bedside, I'm not gonna go back. I'm just gonna continue to build my career from here. Because what you're gonna realize, if you're a nurse already, you could probably relate to this. A lot of people want to leave bedside. And for the new nurses coming in, not all of you guys are gonna have the desire to work bedside. This video is just the general tip, my recommendation of the best way to leave bedside if that is a desire that you have. You know, I'm drinking some coffee. We're gonna take it a little slow, put a little background music here. If you see me looking at my phone here, I just have some general tips that I want to make sure that I do cover. So let's begin. So the first thing I want to give you guys are just general tips, general pointers that I have. These are like bullet points. So the first one that I put here is begin your plan early. That is my best advice. And the reason why I say that, people burn out as a nurse and then it's too late. The people that burn out, it's like you get desperate. I've burnt out in my career too as a nurse. I went through the whole pandemic in the prison where this infection was running rampant. Of course, staff were feeling it. It's not great. It's a very hopeless feeling. You want to just quit and give up. So my best advice is start this plan early. The things I'm going to tell you in this video, start these early. And I can't stress that enough. When you're burnt out, you get desperate. Desperation starts to settle in and you're just not yourself. You start making moves that you probably wouldn't, right? Because you really need to make a move. So my best advice is begin your plan early. The second thing I put here is understand that it will take time, which kind of goes hand in hand with starting early. You start early because when you're burnt out, you want to make that move immediately. It's not going to happen like that. So start early and just understand it's going to take time. So the idea is you start this plan way before you need it. That way, when you get burnt out, that way, when you need the change, right? You've already kind of began the process. You're already a couple steps in. So you're just kind of ready to leave, right? For a different opportunity. So that's kind of the sequence in which I'd recommend. Just general pointers. This third one is this understanding that you may need to go back to school. There's ways to leave bedside by not having to go back to school, but if you do go back to school, and what I mean by this is going back for your master's degree. As people say with the cliche, right? It opens doors, it opens opportunities, and it really does. It really, really does. When I went back to school to get my master's degree, I knew exactly what job it would get me, but I also knew that if it wasn't that job, it would open doors for me. And it really did. It can open doors into management, it can open doors into a more specialized role. Having the degree, as weird and odd as it is, makes you more competitive than someone with substantially more experience. Because that person with more experience may not even be able to get the job because they don't mark the box. There are literally jobs in the nursing field that you can't get without an actual master's degree. They can have all the experience in the world, but literally you have to mark that box. It's just a checkbox. Do they have a master's degree? And if you have that degree and you don't have the extensive experience that the other person has, you actually may have a leg up on that person to get that job. I've seen jobs like that. Don't tell me why it is that way. It just is that way. So keep that in mind. So I'm just letting you guys know I'm not someone who likes school, but, and I told myself I'd never go back, but it has opened doors. It has literally allowed me to get this nursing consultant job that I have right now. Just keep that in mind. And this last tip, this last general pointer, I just want to share with you some general positions that you can expect to see if you're trying to leave bedside. These are just some general examples. So oftentimes you're going to see administrative nursing positions or what you would consider to be management positions, nurse supervisors, directors of nursing, executives in nursing of some sort. Those are all like chief nurse executives. Those are just some general administrative pathways, right? You can look into all of these individually about how to get into them. These are just general, I'm just naming them for you guys. You guys can Google them later. A very common one is case management. When you think of hospitals, clinics, you have case managers. These are nurses that take care of pretty much the care plan for patients, kind of from start to finish or near the end when it's time for discharge. So case management is one. Utilization review. There's also appeals and grievance nurses. Look into that. A lot of people really don't know that. I worked in one at the prison that I worked at, so I know about that one. Another one is advice nurses, telehealth nurses, nursing consultants. And to be a nurse consultant, there's a variety of settings in which you can work. I work for a state government agency. You can work for a healthcare agency, law firms as well. There's a lot of different places, but nursing consultants are just a general term. You can Google that and you could probably see a couple job opportunities under that title. So those are just some general tips, some general pointers. This next phase of the video, I'm gonna timestamp it, but it's how do you do it? Generally, this is the route that I would do. This is the route that I recommend. This is the right way to leave bedside. Like I said, taking the tips from the beginning, you wanna start early and understand that it takes time. So before you fully burn out, right, begin to kind of shape that mindset, right? Know that it's gonna take time. So before you even need it, start to consider it. So I would say wait until about 2 years into the nursing workforce and start to really think about that next step for yourself. Are you looking at your career? Probably not, because a lot of people don't that early on. But I realized, because that's what I did about 2.5 years into my career, the pandemic hit and really forced me to really open my eyes. Is working the floor something I want to do forever? Is it not? Being on the floor as a nurse, is that something I want to do, or do I want to go into an upper nursing position? So those are things I started to see pretty early on in my career because I was forced into that, because I was feeling burnt out. So taking this into account, what I mean is start to look at your career, start to look at the experiences you've had and your interests and the things that you like. Do you want to take a non-clinical nursing route or a clinical nursing route? Both of them will require you to start formulating this plan. Both of these, in a way, are non-bedside positions. Non-clinical is going to be the most non-bedside. These are going to be all those positions I just named, from managers to nurse consultants to utilization review to case management. If clinical is your route, you could do CRNA, you could do NP, and those are the most popular. And there's so many different types of nurse practitioners. Family nurse practitioner, psychiatric mental health nurse practitioner. There's a couple of them there. Nursing midwife. There's a couple to choose from. But the thing is, the non-clinical is going to be the most non-bedside. It's non-clinical. If you go the clinical route, you will be leaving bedside, but you'll still stay clinical, which in a way will always still keep you bedside or patient facing, right? So keep that in mind. NPs, CRNAs, they're still patient facing, although at a higher level than a bedside nurse. So it's going to feel different. It's going to feel less, but it's not non-clinical. Like if you're really trying to leave bedside, leave a patient facing role, non-clinical is the way you want to go. Non-clinical is the way I went. That has always been my desire since I've actually thought about it. It's not that I don't like working with patients. It's just that for me and the lifestyle I want to live, I like non-patient facing roles, because those are the roles where I actually get to work from home, if that makes sense. So that was a big thing that I thought about when it came to choosing the non-clinical route, was eventually I can work from home. Not to say you can't be a nurse practitioner that works from home, but it's still different because it's patient facing. And ultimately, if you're thinking about pay or something like that, if pay is a deciding factor for you, you can make money on both sides. You can make money being an NP, CRNA, clearly, or you can also make money going the non-clinical route, especially if you go into nurse management, nurse administration, even nurse consultants. I'm a nurse consultant. I'm an entry level, but the higher level nurse consultants make really good money as well. So there's different ways to go about it, right? So about 2 years into your career, start to think about this. Either route is going to require you to kind of go back to school. So you do want to think about this as well. I went back to school about 2.5 years into my nursing career because I started thinking about those next moves. And I highly recommend this for you guys. If you have the bandwidth, if you have the energy, really begin to think about clinical or non-clinical, and then a master's degree. If you don't have your bachelor's yet, I'd recommend getting your bachelor's and then getting your master's degree. The master's degree is really gonna open these doors for you. It's really gonna make you a lot more competitive. It's gonna slot you right into a job in the future, I can guarantee you, because most people don't get that master's degree. In my career, I was one of the youngest people with my master's degree, and that marked the box for me, like I said, over those people with a lot more experience than me. But because I had it, I checked that box when other people only had experience and they couldn't check that box. It's just how it goes. It's just something I've found, and I want you guys to know about that. The thing about school is that it takes time. Right, it does. I know this because I went through a master's program during my working time. I went to WGU and got my MSN in leadership and management, and it takes a while. So what do you do in between going to school, working, not getting a bedside role? This is key here. Don't stop in your actual day-to-day career development. This is the piece that will set you apart from a lot of people. What you're working towards is getting a degree that's gonna make you more competitive. I highly recommend the master's, but if you're starting with the bachelor's, that's fine. You can still apply when you get your bachelor's. But in between that time, when you're in school, look to get into maybe a supervising position. I did a temporary management position. It was like 2 months or so. Found out I didn't like management, not for me. Just further solidified the fact that I want to go and try to work from home somewhere. But go ahead and try to get that experience for yourself. You can still put that on a resume, that still looks good. If it's not management, I also highly recommend looking into like the nurse paperwork type positions. But if you can get a role, right, even if you're a backup cover for case management, the discharge planner, utilization review, appeals and grievances, if you can be the backup to them somehow in your facility and get that experience is gold when it comes to looking for a non-bedside role. Because when you're trying to get these non-bedside roles, you've already proven that you've worked the floor, you have clinical experience. Everybody will as a nurse. Now, the key is you have to prove to these people when you apply that you're also good at not thinking like a clinical nurse, but being able to be an administrative nurse, which the skill set is similar. You have to multitask, but you have to do it with software, programs, from a desk, find attention to detail and paperwork, sitting at a desk. You'd be surprised how many nurses actually can't just sit at a desk. A lot of nurses hate it. And I actually at the very beginning hated it too, because I actually worked as a grievance and appeals nurse, like I said, in the prison, and I was getting very antsy and I just wasn't used to it. So a lot of nurses are actually gonna try these non-bedside roles and not enjoy it. I think for the long term of your career, it's a better route to take. It's easier on your body, it's easier on you mentally as well. It's less taxing. You can do it from home. There's other positives behind it. While you're in school, a big suggestion is look into getting this type of experience. So let's say you finally got your degree, you got some of this experience in between, right? Now maybe you're burning out. The idea is you did all this before you fully burnt out and you had to make the move immediately. Maybe you still work on the floor for a little bit. Maybe you don't. Maybe you want to work from home. Whatever it is, at that point, you're now ready. There's no like immediate impulsive decision being made. So this is my best recommendation. If you're working bedside to going non-bedside, start early, maybe about 2 years into your career, begin to think about clinical, non-clinical, think about what degree you actually need. If it's a bachelor's, start there. If you already got your bachelor's, go ahead and get your master's. And if you get your bachelor's, later go back and get your master's. It will be worth it. It'll make you so much more competitive. While you're in school, right? While you're in school, look into trying to get a little bit more developed in your actual career. Go and get some supervisor experience, and go and get desk nursing type experience. Get that experience, you got that degree, and now the whole world is yours. Doing it this way allowed me to leave the bedside in about like 5 years, 8 months or so. Now I work as a nurse consultant, so I know this route works. This is the route that I took. Maybe you could follow a similar one for you. It can work at any point in your career, But if you're early on in your career, just do this early on. That way you have the option. That way you don't hate your job and then hate your life. Because oftentimes our life gets hard because of the job that we work. It's very hard to not take your job that you hate home with you and then live at home with this stress about your job. Our job takes a lot of our mental bandwidth. Set your life up in a way where your job isn't doing that for you. And that's just my recommendation. These are just the ways that I did it in my own career. I really think it'd help you guys. So I just wanted to paint that picture for you about how to do it, how I did it. Hopefully some of this was helpful. If there's any reason you guys ever want to reach out to me, you can reach out to me on Instagram, send me a DM. That's the best way to reach me with questions. I post stories and videos on Instagram as well. A little bit of motivation, trying to keep me and you guys accountable. I'm here if you guys need me. You know where to find me. I'll see you guys on the next video, and as always, take care.